Hello all. Today's case discussion is also from a topic from microbiology. Today's case is a 23-year-old sexually active woman who presents to her physician because of a painful left knee pain and pain with urination. Physical examination reveals a swollen, tender erythematous left knee with decreased range of motion. Examination of her skin reveals small papules with erythematous base on her arms as shown in the figure, and her pelvic examination is notable for purulent endocervical discharge. Okay, and our questions today is: what is the likely organism? What is the DD for her arthritis, that is whether it is septic or reactive or rheumatoid or osteoarthritis? What is the gram stain of the cervical swab? What is the antibiotic appropriate for this patient? And potential gynecological complications due to the condition. Now, concentrating on our question, we have to look at the points of sexually active woman, painful left knee, pain with urination, and swollen tender erythematous left knee towards arthritis. Then papules with an erythematous base on her arms. And also in pelvic examination, she is showing a discharge. So the vaginal infection causing discharge and dysuria, and the bacteria or the organism has also disseminated to form skin lesions. And what is the organism? It is Neisseria gonorrhoea or Gonococcus. Okay, and the type of arthritis here is septic arthritis, and at last we will be seeing how to confirm whether this is what type of arthritis and all. And in this organism, a closely related organism is Neisseria meningitidis. And seeing the difference between these two, meningitis is actually capsulated and gonorrhea is non-encapsulated. Meningitidis is actually lens shaped and this is kidney shaped. We can remember this with the shape of the letters itself. Okay, we can draw two lens shaped things on both sides of M. So meningitis is lens shaped, and gonorrhea G is in the same shape of kidney bean. Okay, so kidney shaped. And the meningitidis, it ferments glucose and maltose. M for M, maltose fermenting is meningitidis, and gonorrhea is fermenting only glucose, or G for G only. And meningitidis rarely have plasmids, and gonorrhea have plasmids which are responsible for the drug resistance gene. And meningitidis is occurring both intra and extracellular forms, but whereas gonorrhea occurs as only intracellular forms. The virulence factor of gonorrhea is pili or fimbriae for adhesion and inhibiting this phagocytosis, and outer membrane proteins like porin, that is protein 1, and opacity associated protein, that is protein 2. And then we have transferrin binding and lactoferrin binding proteins, IgA1 protease, lipo-oligosaccharide. Coming to the manifestations, in males, the most common manifestation is acute urethritis with inhibation period of 2 to 7 days, and complications are epididymitis, prostatitis, penis edema, balanitis, and water can perineum, that is periurethral tissues infection causing abscess with sinus formation. And in females, the most common manifestation is mucopurulent cervicitis. It occurs mostly in prepubertal or postmenopausal women. The adult vagina is comparatively resistant because it has low pH and thick stratified epithelium. The complications in females include salpingitis and PID causing sterility. And it causes a condition called Fitzhugh-Curtis syndrome, where there is adhesions between fibrotic adhesions between the fallopian tubes, uterus, and liver, that is peritonitis plus perihepatitis will present. And also this is called as Fitzhugh-Curtis syndrome. And also there is risk of ectopic pregnancy in these females due to the adhesions or that inflammations in the tubes and so on. And in both sex, the common manifestations are anorectal, pharyngeal or ocular gonorrhea. In neonates, we know the condition of ophthalmia neonatrum, which is diagnosed as purulent eye discharge within 2 to 5 days of birth, and the treatment we know that is the Credes method. And there is another condition that is disseminated gonococcal infection, also called as DGI, and this occurs in risk factors, namely menstruation and complement C5 C9 deficiency. Laboratory diagnosis: the samples, in males it is urethral discharge, females it is endocervical swab, and in DGI it is blood culture and synovial fluid culture. The transport media, all these media names are important in this gonorrhea chapter because it is asked as previous year questions in NEET and Aiims. The transport media for gonorrhea is struvite-amines media, that is charcoal impregnated. Jembeck system, that is CO2 generating system for long holding period. And gram staining, in males the gram stain is more sensitive, that is 90%, but in females it is less sensitive, that is 50 to 60%, due to the commensal Neisseria which is present in the cervix. And so in females, endocervical culture is recommended for diagnosis. And culture media, we in case of acute gonorrhea we use chocolate agar or Muller-Hinton agar, and in case of chronic cases we use Thayer-Martin media, Thayer-Martin media, or modified New York City medium and Martin-Louis medium. The treatment part, it is ceftriaxone is the first line treatment, but we have co-infection with chlamydia as well. So empirically we can also start with doxycycline or azithromycin along with ceftriaxone. Now coming to the DD of the arthritis, the patient here, she is having actually septic arthritis, and how will you confirm is mainly by the synovial fluid WBC count. If it is less than 2000, it is mostly going with osteoarthritis, which is a non-inflammatory type of arthritis. And in case of reactive and rheumatoid arthritis, both are inflammatory arthritis, and the WBC count in the synovial fluid will be between 2000 to 75,000 cells per millimeter cube. But in septic arthritis, the count will be very high, that is, it will be more than 1 lakh cells. Osteoarthritis is usually benign, and reactive arthritis you can straight away identify because it will show a classical triad of uveitis, urethritis and arthritis. This is due to chlamydial infection. And septic arthritis you can further confirm with gram stain or culture of the fluid to diagnose. That's all for today's discussion, and stay tuned for further videos. Thank you.